March is Endometriosis Awareness Month. Endometriosis is when endometrial tissue implants outside the endometrium. So the endometrium is the lining of the uterus, and if that tissue is found outside of the uterus, it's called endometriosis. Sometimes we call it ectopic endometrial tissue because it's not in its normal position. If that tissue implants in the ovaries, it forms large cysts called endometriomas. Now, the most common symptom of endometriosis is pelvic pain, and the pelvic pain does not necessarily equal how bad the endometriosis is. So, for example, at laparoscopy, which is a small surgical procedure where we look and see if a woman has endometriosis and can either excise the endometriosis or ablate it, some women we can find a ton of endometriosis and that woman never complained of pain. And some women we find just a few spots of endometriosis, but that woman has significant pain. A lot of it has to do if that endometrial tissue implants next to a nerve and therefore causing pain from that nerve. Now, what are the causes of endometriosis? The reality is we truly don't know what are the true causes of endometriosis. There are many theories behind it, though. One of the theories is retrograde menstruation, meaning instead of the menstrual fluid coming outside the body during menses, it actually backs up into the uterus and into the fallopian tubes and then into the peritoneal cavity and then seeds the peritoneum and it becomes endometriosis. Another theory is when cells within our body, what we call pluripotent cells or stem cells, they essentially become endometrial tissue but outside the endometrium. Another theory is the transport system in our body can sometimes bring endometrial tissue from the endometrium to other parts of the body. Now, as a fertility doctor, I get many questions regarding endometriosis and infertility. There are 4 stages of endometriosis: stage 1, 2, 3, and 4. Minimal, mild, moderate, and severe. Minimal and mild endometriosis, many times those women can get pregnant naturally or with simple treatments like ovulation induction and IUI. Moderate to severe endometriosis usually requires in vitro fertilization to get pregnant. In terms of other forms of treatment, let's say you're not trying to get pregnant and you need a treatment for endometriosis. Surgical management, which some infertility patients may need surgical management before IVF, the most common surgical management is laparoscopy. A laparoscope is a telescope that we put inside the belly and look for the endometriosis and either excise or ablate the endometriosis. Medical management for endometriosis include birth control pills and then an injection called Depolupron or a pill called Orilissa. Essentially, these medications will shut down the female's reproductive system, and Depolupron or Orilissa will turn off all the hormones in a female reproductive system, essentially putting you in medical menopause, and therefore your symptoms or pelvic pain become less. You would only use these medications for a few months. It's never for an extended amount of time, just enough to help with the pain, and then once you're done with those medications, switch to something like birth control pills for long-term maintenance. If you're struggling with endometriosis, please see your OBGYN doctor to ask about treatment.